Freedom to Know Wellness, a disability advocacy platform to hold space and give a voice to those with complex medical and chronic pain conditions, female reproductive challenges and miscarriages, and address other disability-related topics, including how these experiences affect one's mental health. Welcome to Freedom to Know Wellness, where voices are heard. Please advise, the information provided in this episode is from the opinions of the interviewee and interviewer. For further medical advice, please contact your practitioner. Now, let's start the interview. Welcome to Freedom to Know Wellness. I am your host, Michelle Samuels. This episode is in honor of Black Maternal Health Week, advocating for improved care of Black women and other women of color in maternal and reproductive health. Many conditions such as high blood pressure, gestational diabetes, and preeclampsia impact Black women in maternal health more severe compared to their white and some women of color counterparts. For example, in Canada, preeclampsia is a 1-to-1 ratio higher than white women, and in the USA, preeclampsia rates are highest in Black women by 60%. Hispanic and Indigenous women also have an elevated risk of preeclampsia. Care of all women in the medical system impacts women's health tremendously, with conditions like ovarian cancer often misdiagnosed and a correct diagnosis not made until later stages, leading to higher mortality. Like in Canada, for example, with a 44% survival rate. Ovarian cancer rates, according to research, tend to be lower in Black women, but have a higher mortality rate due to the likelihood of being diagnosed at later stages of the disease. Now, why is that? This type of high misdiagnosis based on race is one-off, but an important topic discussed in today's podcast. This is a longer episode, so sit back, grab a drink or a snack, and listen. Today we're discussing the topic of chronic pain, medical gaslighting, and the issues that surround medical gaslighting around women of color. Also, we are addressing the topic of miscarriages, pregnancies, and all things medical that surrounds this topic. Today, I have a special guest. She's going by the name of Efia, and she's going to share her experience, and I'm so excited to talk with her because having conversations with her and about her life experience managing chronic pain, managing pregnancies, and also experiencing losses herself has really inspired me of how she took an initiative to take care of her health, especially as a woman of the African diaspora, and to be able to make sure, you know what, I'm not going to talk anymore. I'm going to have her share what she has done. Welcome, Efia. How are you doing today?
Thank you so much for having me. I am in high spirits. I'm feeling blessed just to reconnect with you because we've known each other for some time. So I'm really honored just to share this space with you right now.
Wonderful. Thank you so much. I appreciate you taking the time with me. So, Efia, you have a family, correct?
Yes, I am married with 2 children, one that I recently birthed and one that I adopted recently as well. A lot of changes.
A lot of changes. Wonderful, wonderful. Honestly, a lot of us as women, knowing that that's an opportunity to be able to not just adopt a child, but to be able to help a child who is in need. And the fact that you guys initiated that, especially with the newborn, is amazing, to be honest. So wonderful. I'm really proud of you and your husband and your partner.
Thank you.
So, and do you operate any business at this time, or what type of employment do you do overall?
Right now, I'm still recovering postpartum, but also really my attention has been on the kids full time. I do run a digital design as well as a customizations business where I do laser customizations and I do work on events and other custom art commissions as well. However, I'm working with other artists right now collaboratively, so I had to turn my business more into a collective so that I can share the spotlight of up-and-coming artists as well as some local artists that I connected with through my prenatal and postnatal time of being in the home and being in that very creative space, I realized that though I couldn't go to events or, move around as much, I could just help others, just kind of be in those spaces with my referrals. So that's what I've been doing, a lot of admin for arts and culture and events.
Wonderful, wonderful. As a one admin artist person to another, I love that. I love that you're doing that and take initiative even during your postpartum. So we were talking about chronic pain. Now, you've been experiencing chronic pain for how long now?
This has been a challenge for the last 6 years.
Mm.
Yes, it's still a bit of a challenge, a lot of adjustments, especially with the seasonality of like the weather and the effect that it has on people facing chronic pain conditions. And so for the last 6 years, I've been just adjusting. And then with the pregnancy, that also was another adjustment.
So is it widespread chronic pain or is it a specific area?
Yeah, it's localized and it's actually like on the right side of my body, meaning like my dominant side, um, through nerve damage.
Oh
So
my
both
goodness.
my leg and my arm, like especially just turning a knob can be like electric pain through my body and up to my brain. Like I get migraines and a lot of other issues with my vision attached to that nerve nerve pain.
And did they provide you with the diagnosis?
So there were multiple diagnoses.
Mm-hmm.
There was a sciatica for my leg, and then there was a wrist fracture, like a hairline fracture, that was diagnosed for my arm. However, there are still, with nerve pain, there's a very long process here, and it's really tough to find the proper specialist to hear you out, much less diagnose you, much less help you find the solutions that are right for you. So that's why these years have been more challenging, a bit more of a fight.
So you still don't have a direct besides like the sciatica and of course those direct individual causes to those pain. The reason why you have this pain going from your foot all the way up to your eyes, your head, etc. There hasn't been a specific diagnosis. You're still in search of that diagnosis.
Correct. So I'm still seeing a few specialists for holistic care, but also there are a few sort of diagnostic tests and exams that I'm still going for.
Hmm.
And so I'm pretty much seeing individual specialists for the confirmed challenges. Like I go to somebody for my leg and then somebody different for my hand. And then I have different medications from a different doctor for the head, the migraines, and also the blood pressure that comes with dealing with all of these things at once, right? So
So the blood pressure was before the pregnancy?
it became an issue through the pregnancy,
Hmm.
so it wasn't as much of it. Like it had been nearing, the red zone. However, pregnancy and the risks that come with pregnancy heightened my heart condition challenges, and so there was a separate specialist to see, not just for the pregnancy for myself and my heart, but also for the baby.
Oh, so the baby was also impacted.
Yes, so halfway through my pregnancy, I did have some challenges where I had to see another specialist to monitor the baby towards the last few weeks. And then the baby did come a little early. And so there were a few mobility issues and many other issues with a growing body and a growing human and all the extra weight and stress on your organs, that needed extra checking in. So towards the end, I was definitely seeing the specialist every week.
Oh, goodness. Okay, we're gonna go further into that a little later on. So with the 6 years that you've been dealing with this chronic pain, do you know what caused it initially?
Yeah, so initially, I was fine until after a highway car accident, which Toronto is very famous for. We have one of the most dangerous highways in the world. And so it was a sudden change from the car accident. My memory was also impacted because I did get a head injury, hence the migraines. And so I don't remember all the details. Other people in the car would explain to me what had happened. But yeah, it was pretty much from then on, I acquired like a disability that I really never had to consider, and my entire lifestyle was changed from that day on.
So, with what you're experiencing, this is considered an invisible disability. Living with extreme pain, but it's not noticeable because of how you look, or you're not necessarily using any devices, etc. How have you found working, living life, etc.? How has it impacted your emotional and mental well-being? How has it impacted your partners or your parents, friends, and family in regards to how they manage with you? Because you have to adjust yourself according to this pain.
Yes, it's so many adjustments. I think it was a lot of rebirth is the best way I can describe it because I had some issues with my speech coming from the head injury, and I wasn't even aware because when you're even just communicating with people, it sounds different in your head, but what you're saying to people, they would be confused by. And that's one of the challenges of dealing with head injuries. And there are a lot of individuals that aren't even aware, like, because of this, and aren't able to advocate for themselves and speak with a health professional when the communication is impacted or your words, like you're not able to grasp the correct words. So that was a challenge, adjusting my speech as well as the mobility side with my right leg and my right arm. Being my dominant side, I had to learn to shift a lot of my ways of moving and also just really managing my energy and then managing the pain with multiple um, solutions. Like I had to really stand up for myself once I came out of the fog, as I like to call it, and then, stepped out into the world of the busy beehive of like the medical field and dealing with specialists and going to the pharmacy and all these things that are involved following such a lifestyle change. And in pain management, like a lot of times there isn't one solution. You kind of have to look at it holistically and, work on different pieces and
Mm-hmm.
find your balance. And so that was my experience. It was tough to communicate with family and my care team. And I had to really go and learn the healthcare system behind the scenes to understand what my rights were and
Mm-hmm.
the best way to advocate for myself once I started to regain the confidence. And
So, and I can completely relate to what you're speaking about, having several head concussions and trying to communicate and trying to articulate yourself. Sometimes you think you're saying one thing and it's like you're saying the cow jumped over the moon when you're actually speaking about the refrigerator or something gets mumbled jumbled. And plus now you have to be, it's ambidextrous. We have to be able to use both hands because you're trying to balance and compensate for the other side. With managing the doctors, as you're saying, it's hard to be able to articulate yourself. Did you find, first of all, I'm understanding that you did not feel heard when you were speaking to the doctors, correct?
correct, I felt I had to really go multiple times and make the same complaint like over months to finally even get a referral. And just a referral to a specialist, which is also going to take some time to start that process, took literally like 3 months or so. And so struggling with the pain, not having the proper medication balanced because you're dealing with different types of pain and you're also moving through life and having the daily challenges with that mobility can heighten your pain. And so sometimes it's interesting, like in the medical field, when people are labeled as drug seeking, when it comes to pain management and the types of medications a person might need coming from such an injury. And so that was my experience, like just just trying to be heard took weeks and months, or trying to, like, I found I had to make a complaint 3 to 4 times and request that it be documented on my file, because part of learning my rights in my health records was that you can talk to the doctor, but if it's not written down, it never happened.
Exactly.
And with the electronic health records, I learned during the transition to the provincial healthcare system to have the care team having open access to parts of your medical history, and then bringing the pharmacists and the different doctors and specialists into your care team with a centralized document for your health records was something that I had to learn, because I think documenting things is so critical in this part of the world. And where I come from, we may respect oral stories and the griots and storytellers that pass on our history, orally, or verbally. But here it needs to be written down. It needs to be documented, and you need to confirm that it has been documented. So I think another thing of learning about the healthcare system was that I could now request my records and understand what to say, especially when, like, even a secretary in a doctor's office might be the barrier, because the form that they must fill might be an extra step for them that they don't want to take. And things like this are faced by a lot more BIPOC individuals. So, and for those that don't know, Black, Indigenous, people of color face a lot of, like, not being taken serious in the healthcare system. And so it was really rough for me at the beginning. But once I learned the lingo and I really, like, equipped myself by, like, putting into practice and building the habit of going to your doctor, no more than 3 months to see your doctor. Like, these are the things that people are not aware of. Some may go once a year, but I learned all these changes to my habits were very critical.
So let me just clarify. Did you say you go to the doctor, the regular doctor, once a year to address your concerns?
No, but I know that it's common for my peers.
Yes.
Just from talking to people openly about, these situations and what their experiences were. But I have to go at least every 2 months. And also, like, sometimes even more frequently, based on, like, the weather impact on my body, and making sure that all these things are documented so that it doesn't get swept under a rug.
Exactly.
And also because over time, like, conditions may worsen, because if it takes 3 months to get a referral, after those 3 months of dealing with the pain and your body being worn down from the impact of that, without the paper trail, nobody believes you. So always, advocating, requesting, and then checking that it was done and done properly and is linked to my health record, like my health card number. Like, you think this is what the doctor's office and secretaries there are meant to do, but you do have to really check that things are being recorded properly so that it can tie back to you pretty much.
What I find with people who have multiple health conditions, especially when it comes to chronic pain, one will just remember, oh, she had the sciatica. Oh, she just has the migraine. But to remember the collective of, what's going on with your whole entire body, all the collective pains, and that they have to be addressed. It's like out of sight, out of mind if you're not continually to repeat and say, these are the problems. It's all a collective thing. And it gets very frustrating because it's like, oh, you're here complaining about it again. No, it's an ongoing thing. It takes a process to help one, to help the other, and to help the next. Because you have, call it three, but it's actually multiple things more than three that's impacting you. Sorry, I'm going through this right now myself, so I'm a little frustrated for you. Not a little, I'm very frustrated for you. And oftentimes it's just ignored. It's not properly documented, as you said. And the fact that you even had to make a complaint, and if you don't mind, without going into extreme detail, could you kind of explain what was the process of the complaint and why you had to make the complaint?
Yes, there were a few situations that pushed me to actually seek like support from the provincial healthcare system directly, and then to go and learn the system, like the ins and outs, to be able to advocate for myself now. So, yeah, I found that a lot of times, as you said, like there may be a focus on one and not the whole picture, the holistic um, care that's required. And um, I'm really sorry I blanked just now.
It's okay. It's okay. No, I was asking what was that specific situation, for example, without going into extreme detail.
Yes, I was actually trying to get a pain medication. A prescription refill is what
Mm-hmm.
sent me like into this really like wanting to learn and understand the system better, and also
Mm-hmm.
like the power structures, because like physicians have their board, doctors have their specialists have their board, like a governing body to make sure that people in practice are up to date and people are being non-discriminatory in the
Mm-hmm.
healthcare system, which is a bit of a joke. Sorry, I'm laughing. But yeah, like that, even in the terminology that's being used when your healthcare is being documented, an individual might say, you're drug seeking on one day, and then on another day say that you're seeking an intervention or you're in pain. So it's a different wording that's used even at the like base level of note taking for your appointments that you
Mm-hmm.
need to really check. Because what I found was, though it was a prescription refill, because of how the information was transferred to the pharmacy from the doctor's office, I was left waiting for almost 45 minutes for my prescription and seeing a whole bunch of people going. And just like, I had been here for nearly an hour and being told, oh, they need to check things or they need to confirm things about my medication that I was on for a while. And so the fact that it was a refill and I was facing like certain extra steps that nobody else was helped me be like, you know what? I need to do something. I can't just sit down and bite the bullet and be patient. And for how long, especially while I'm sitting there in pain. And it literally did take an hour and 15 minutes to finally get out of the pharmacy. And this is a pharmacist that
Mm-hmm.
just has to like give you the stuff that is printed according to your health card number, and whatever is prescribed is what they need to give you. Especially when it's a refill, it doesn't usually need much consultation with the pharmacist. However, for whatever reason, there were excuses of forgetting about me being there or not seeing me where I was sitting in front of them. There were so many weak excuses, just to waste my time on that day, that I had had enough. And that's what really pushed me to do more for myself and stand up for myself, because I felt like sitting in that pharmacy, like watching people coming and going, having like watching individuals have like casual interactions with the pharmacist while I waited, and then him kind of laughing in my face um, about forgetting about me sitting there for nearly an hour. I think that incident made me say enough is enough,
Mm-hmm.
because I had already seen the doctor and gotten my prescription. And it wasn't even something I came in with, it was sent directly to the same pharmacist that I always go to. And the fact that the loyalty that I showed to these institutions was returned with me sitting there for an hour and 15 minutes. I have to laugh about it.
You have to now. Yeah, you have
I
to.
have to. That's the only option for me. But that really opened my eyes to like the experience of so many, so many others. And I wanted it to kind of end with me where it's like some individuals may not feel accountability.
Mm-hmm.
However, if I could do something extra like send an email or fill a form, I decided to do that. And that's when I learned about complaints processes with the governing boards of whomever I may be dealing with.
Do you remember the website that you went to do the complaint process?
I do not remember the exact website, but it's an
Okay.
Ontario governing board. And so for whatever specialist you're seeing or whatever, challenge you're having, because a pharmacist is a specialist just like a physician is and an OB is, and there are different boards provincially because for healthcare workers to practice in each province, they need to register with that board.
Mm-hmm.
And then if they're having any history that, a pattern that's emerging with the complaints, that board is who would have record of that. And that's why
Okay.
it's important to make that complaint because you don't know how many people have faced this and not said anything or suffered silently.
Mm-hmm. One of the conditions that I have was brought on by a very bad chiropractic misalignment that was done against my will. And I filed a complaint against them. And it was hell going through the process. And I went through about 3 processes trying to go through the legal matters, what have you. And by the time I was done, I sat there in the chiropractic association's office. And they see I was struggling physically, and they said, "We see how bad you are, but there's really nothing we can do." And I'm not saying this to be able to dishearten anyone from moving forward. I wish I had pursued other avenues, but it was so hard when you're trying to do things independently and, managing the pain. Um, I was even trying to work, I don't know how I did it, to be able to pay for my, medical treatments just to try to help myself. And that actually shot me in the foot for doing that actually, because my lawyers were like, "We see how bad you are, but the fact that you're even trying to work, that poses a problem, and that shouldn't be. That should not be." I'm really glad that you made the complaint and that you are bringing awareness, because the point is, even if they're not able to help you, that is documented under that practitioner's profile, so that when they see that someone else makes another complaint, hey, there's something wrong here. There needs to be changes. So I'm glad you did that. And if you can remember whichever board you did, I will post that in your interview so that people can be aware of who to contact in that specific circumstance that you're speaking about. So
Yeah,
thank
and
you.
honestly, Michelle, platforms like this are so needed because people are not aware
Hmm.
of their rights. People are not aware that they can even make a complaint because people feel like, a lot of these institutions for so long have treated them a certain way. It's become normalized.
Hmm.
And sadly, like if we don't do it, nobody else will.
Hmm.
And I think for all those who can't speak, if you do have a voice, it's so important to use it. And if you have information, there's no need to gatekeep because the importance of documentation is sharing information beyond your lifetime, right? Putting
Hmm.
pen to paper is the legacy that gets passed on. And the type of information we're sharing, it isn't really about these things. It's almost taboo to have these healthcare related conversations in my community. And so I intentionally want to talk about, especially with other mothers. Like I think a lot of information was gate kept where, it only gives you a partial view of the bigger picture. And so if I can clear one more section or one more corner of darkness and bring light to that, I don't see how anyone would lose. And that's
Hmm.
also why I really support what you're doing. And maybe we do need to build that resource from the ground up and circulate that
Exactly.
guidebook or all the resources, not just the one that I used for a complaint, but even other links to other sites for more
Exactly.
information. because
Yeah.
information is powerful.
Exactly. And that's honestly the reason why I even launched this is to have an online resources for all things like this, various information that people can reach out to be able to obtain information. It's funny enough, I was just in the grocery store and this man was asking for information on things for accessibility for people, especially for seniors. And I have a whole online resource section for that. And I was able to forward him to the website, and he was able to use it to be able to help a person. These are the things with the information that we're discussing is what I want to do. And I know that's something that you're doing as well. And it's important. People need information. Definitely need information. Going back to the medicine that we were talking about, I find a lot when it comes to especially pain medications, narcotic medications that are issued by doctors, even when it came to medical marijuana before it became legal. It was a huge problem for people to be able to obtain, even though the doctors have you sign a waiver to be able to state that you're not going to sell it. This is the situation. You even have to see a special compound pharmacist sometimes for the medications that are being prescribed. One doctor may say, okay, I'm prescribing this to you. I believe in what you're doing. Now you see another specialist, they look at your medications and they start questioning you and they're looking at you. And I'm going to share a quick example. I had to see a specialist at Toronto Rehab, and he's going over my prescriptions. And as they're talking, I'm on a lot of medications to manage the pain. And I was going through a very severe flare up. And I've never been a person to use drugs even prior to my condition, not even marijuana, nothing. And so as I was explaining to them, this was before marijuana was legal. And the cannabis medical clinic had to provide us with options. I didn't believe in smoking marijuana at the time or vaping marijuana at the time. So I said, well, what are my other options? Can I make an oil or something? They said, yes. And they gave me the directions on how to make oil. And I did the best according to what I knew. I knew it wasn't as strong as I should have it because after a time being, they were able to sell the oils so that we can be able to have the correct prescription. So I was trying to explain it to her and to the doctor that I was speaking to. And when my family doctor and my pain specialist saw the report and said, I think she is addicted to marijuana because of my description of how I had to make it and whatnot, even though this is something that my pain specialist sent me to a medical clinic to learn and to do. And they've prescribed it to me for me. And my family doctor, who has known me since I was 11 years old, just shook his head. He goes, what the hell is this? He goes, I know you. I've been seeing you for years. I know your medical circumstances. And when my pain specialist saw this, he goes, what the heck is this? And I realized, I said, please, God. I was like, don't tell me because I am a Black woman. And you know, the stigma with Black people or Indigenous people when it comes to cannabis or any of those type of narcotic medications. And I was on narcotic medication on top of it because that's how severe the situation is. That now I'm being labeled for something that I have never done or I'm not even doing. And the quantity of marijuana was lower than what I'm supposed to even be taking. This is a problem. Sorry, I'm getting a little frustrated, but this is such a huge problem. Now you're going in there to your pharmacist to be able to get your prescription. Painkillers, there's so many different types, hard narcotics to the ones that are lesser, but still, it's still extreme medication to be able to manage pain. And this is what you're going through? Sorry, I just had to do a little rant on that, but this is a big problem. This is a big problem. And it doesn't help your mental health as well.
And I appreciate you bringing up the mental health impact because sometimes every visit to either any waiting room, really, any specialist, any ER, God forbid, we do have to sometimes go in when the pain gets so severe. But any interaction with even the secretaries in healthcare, like these can really change your outcome and really affect you because the note taking is very biased.
Mm-hmm.
And this has been proven over decades of records and studies and data being shared to say why when a person of color is asking or even seeking even information about their care rather than just following blindly. Just asking questions can be taken as refusing care. But with another individual who is not a person of color, it's suddenly seeking alternatives or seeking holistic options. Even in the note taking from the first interaction with a person, even if you don't talk to them, like you said, by them looking at your health history and making their biased assumptions, that can really change things and impact you greatly. And I think it affects your mental health. I mean, 6 years of going and dealing with this, and like sometimes even every month you have to go in.
Yes. Yes.
God
Yes.
forbid when you add, like when you layer the challenges with trying to procreate,
Yeah.
trying to carry a baby to full term is not easy. So I think that, like just every interaction can really, really affect your mental health and give you anxiety to even
Yes.
enter these institutions.
Yes.
I found myself like having to really do breathing exercises and woosah a bit in the car, like just, just to enter the waiting room, or sometimes being like, look, can you just text me when it's time because I can't be in here, with on top of all the medical challenges that we were facing during the pandemic, through that really just made things a lot more difficult. And all that weight on the brain is something that we need to talk about, we need to
Yes.
address, because holding it in is not helping us. And generations, we've lost a lot of women in our generations to the silence and the taking the bare minimum when you're paying for a service. It's not for free. And when it comes to pain management, people need to be aware that a lot of treatments are not covered by the
Yes.
basic or even sometimes extended healthcare plans. I had to see a specialist who was recommending some injections in my spine. And I would have to go like frequently for follow-up treatments, but that was what was based on the diagnosis. And the hurdle there was having to pay out of pocket because it wasn't covered, or having to see another specialist needing another referral, which
Yes.
would take more time while I suffered silently. So I said no. And I think more of us need to really step up and just speak about it. And, that's how the work kind of begins to start to change things.
Yes. Yeah. Doing those trigger point injections in the spine, not everything's covered. A lot of different blood works and different types of treatment, not everything is covered. I, my doctor just recently sent me to a specialist, and they were like $600 for the first appointment. And I had to go back to my specialist. I said, what? I said, do you realize that you're sending me to someone, which yes, could probably help me, but that's that much? And it's just ridiculous. She's like, no, 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 that's completely out of pocket. That's ridiculous. What
Yeah.
other
And
hope?
these are some of the barriers, right?
Yeah, yeah,
Yeah.
it does. What, before we move on, what additional holistic treatments have you implemented, and what was it? Why did you decide to do that or to go that route?
Well, all of them are out of desperation because
Mhm.
I tried acupuncture and I'm scared of needles. Every injection, I have to look the other way and remember my last vacation or go somewhere in my mind, because I don't like needles. I don't like injection. I don't want to see the piercing of the skin unnecessarily. It's just something I was born with, and I just don't like it. And so, yeah, like acupuncture was an interesting journey. Massage and physiotherapy, cupping, so many things. The list is pretty long. I've been to nutritionists, and, I've gone through even weight management plans and weight loss plans as a part of like the holistic care, and maybe relieving some of the pressure on my right knee by losing weight and changing my diet. Also moderating my blood pressure with a lot of natural juices. That was seeking the holistic support from an Ayurvedic specialist, which sometimes when you seek alternate care, it can hurt you where you're you face more of the bias because when it's in your record,
Mm-hmm.
seeking care because the care that you're receiving isn't working,
Mm-hmm.
people can pass their judgments on that, right? So there's so many layers to this challenge that only gets worse with time. And you can imagine carrying the weight of people not believing you while you're feeling like, glass going through your body, or you're feeling like your back is on fire in
Mm-hmm.
the middle of the night and you can't
Mm-hmm.
sleep and you're in
Mm-hmm.
so much pain, you're throwing up, and
Mm-hmm.
explaining this over and over again and
Mm-hmm.
still facing the disbelief that comes with seeking care. It's a lot, and that's where the mental health impact also like just piles up on top of everything and snowballs. And so it took a lot to get here.
So, trying to conceive, and you said you also experienced miscarriages. Do you mind sharing a little bit about that process with managing this chronic pain?
Yes, trying to conceive was such a challenge, with mobility issues and everything else. However, it was also a long journey. It took about 3 years.
Mm.
And as you mentioned, a lot of ups and downs to finally see the rainbow after the storm. Also, to consider other options because of how tough it is of a journey, year after year, treatment after treatment, or attempt after attempt. It's like, okay, trying to really trying to conceive is not easy for everybody. I know a lot of individuals that have had different journeys, but not every journey is the same. And I think people are more willing to talk about one cookie cutter story when it
Mhm.
comes to like this, and not really being realistic about the fact that we're all individuals with challenges and we're not perfect. But this part of the world seems to be based on images of perfection, which really leaves people are willing to say, no, I'm not perfect. I'm human. And to be human is to err. It's to not be perfect. And so those that are willing to do that all, can sometimes be pushed out of that, pushed to the sidelines. And so that was my experience.
And when you were trying to conceive, because you've already were managing the chronic pain prior, so how did you manage coming on? Did you have to come off of some of your pain medications in order to conceive? What was that process managing medicine, pain management, and trying to conceive?
Yes. So I did have to learn a lot about my prescription medications and make changes
Mhm.
because of the results that I was getting. And then there was a time when I did give up, and that's actually when God said, okay, like, here you go. But yeah, like, there's a lot of considerations with drug interactions when the hormones in your body change for getting ready for pregnancy. And then through pregnancy, all the hormonal changes. And there are certain medications that can be passed through in vitro, or
Mhm.
can affect the baby, while there are some that are at a lower dose, you can manage. But I found I had to really come off certain medications completely because they were working but would have not been good for my baby. And so those were the hard decisions that I had to get as much information as I could to make, an informed decision.
So you had to speak both to your GP and also your probably your holistic practitioners to be able to find other alternatives, more natural alternatives to manage the pain, even though it's not as effective, but just for you to try to conceive, correct?
Correct. Like, I really wanted to be able to go to the full term, and a lot of the medications for things like blood pressure or for pain management or for even for the migraines, because nerve pain is treated a bit differently
Mhm.
than muscular pain and other forms of pain. So
Mhm.
I found that that was a huge challenge because I didn't just have to go to one or two people. I literally had to speak to my entire care team. And even down to getting the ultrasounds, I had to ask if certain ultrasounds were necessary because of my past experiences, where even in the pregnancy, care plan that is standardized here, you need to really see what works for you or what doesn't. There are some Some things are done just because they're standardized, but they're not necessary. And if you go to like a doula rather than an OB, or when you go to the hospital rather than a birthing center, it that's when you really see the difference in the type of care and your autonomy over your body to get certain things done. Even running the labs and checking your blood, there's so many things that you have to be able to make an informed decision, but the information isn't accessible.
So that's exactly actually what I wanted to ask you. So during your pregnancy and trying to conceive, were you seeing an OB or did you automatically go and see a midwife?
I actually was getting information from like midwifery clinics, and then I didn't get assigned an OB until, um, well, usually you don't get assigned the OB until everything is confirmed in the first trimester,
Hmm.
especially if you're high risk.
Yes.
And also, some of the other specialists come along the term of pregnancy.
Hmm.
So you do have to reach certain milestones to even have access to those care practitioners.
Yes, the pregnancy care. When you what they call it, the pregnancy care, when you officially start having that.
Yeah. But I
Um,
found the conversation was much easier to have with midwifery practitioners because I found that they were more willing to just share like about your rights in that situation in healthcare, and they could show me the difference between going to like the process of giving birth in a hospital versus a birthing center versus a home birth if that's an option for you. And I got a much deeper understanding, sadly after miscarriages, but sometimes that's the fire to go and seek the information and learn. And so I got a lot of information from talking to midwives and having access to even like the healthcare line that the city finally has created, and individuals can dial in and speak to a nurse. And a lot of nurses gave me very practical information that helped me feel empowered.
um, Let me ask you this question. So this could answer the whole question collectively. You had how many miscarriages, if you don't mind me asking?
I had three.
Yeah, 3. And going through those miscarriages, what what interests you in seeing a midwife?
I think the second one, which was like a medical one,
Mhm.
where the pregnancy had to be terminated to protect my
Mm,
health.
yeah.
That was when I realized, okay, like there's a lot that's not being spoken about. And also, there's a lot of healthcare challenges being faced by women of color or women of African descent,
Mhm.
just due to like healthcare standardized that's not for us, or a healthcare
Mhm.
that's a system that's not built considering
Yeah,
us.
it's
And
not.
so there's a lot of like labs that will check things based on a Caucasian woman or based on a Caucasian
Caucasian
man,
male,
even. Yeah.
exactly, the RIs,
So
yeah.
these things don't really relate or translate well for us, and it can affect everything from your drug dosing and many many layers to that. But
So just to update, my listeners, what, Efia is talking
Clarification
about.
disclaimer. Race is not entirely excluded from medical testing, but many practices are based on the racial population the medical system was originally based on. Extra steps and extended testing are necessary to create a comprehensive medical system for all
Called
races.
reference intervals. It's a range of values typically derived from a population of healthy or disease-free individuals used to interpret patient results. Now, the problem with the healthcare system is that instead of taking the time to have the individual cultures, that population to be able to say, okay, when we test, we're going to test, this is a Black person, we're going to test and assess it based on the Black person or someone who's South Asian. The test markers are just standardized based on Caucasian male reference intervals. And with that being said, it makes it difficult to be able to assess the correct iron levels, like blood levels. There's so many different testing that doesn't coincide with what a Black woman, what a Black male, South Asian, etc. person would carry. So a lot of times the testing isn't accurate and doesn't support our healthcare, our health system at all. So you experienced this, Efia, when you were going through your pregnancy. So what did you find that was a contradiction?
There were a lot of things even before, before the pregnancy, but after
Mm-hmm.
that second miscarriage, it became clear to me that a lot of the challenges, like even from like menstruation and your
Mm-hmm.
cycles, and even some of the medical treatments can have an impact on, like those more invasive ultrasounds can have
Mm-hmm.
an impact on you, and some of the pap smears and all these other things that are standard practice
Mm-hmm.
have a greater impact on colored women.
Yeah.
And so a lot of ovarian and PCOS and many other, like a plethora of challenges are coming from medical, like the medical system that's built not for us. A lot of
No.
mistakes are happening. Individuals' wombs are being removed unnecessarily
Mm-hmm. Oh yeah.
because of this standardizing that you're speaking of. And sorry, I'm getting a little
No, it's
emotional.
frustrating. It's very frustrating.
Yeah, and individuals are going their whole lives struggling to get the proper care, struggling to conceive because they're not realizing that, oh, it can be something as small as using a tampon versus a pad. Because even the feminine care industry is also based on a Caucasian
Asian
man,
person or a woman, yeah.
mostly men. When you
Mm-hmm.
really
And mostly
look
men.
into these companies and how these products came to be,
Mm-hmm.
and these products you can get everywhere. Some of these products are being given to us, and these are the products that are causing the miscarriages. The chemicals in
Goes in
these,
it.
in the
Mm-hmm.
process, even sometimes in the packaging, the chemicals in the hair extensions that people have been putting in their hair. It's only now researchers saying these are full of carcinogens. This is why, the ovarian cancer is impacting certain communities more.
War, exactly.
This is what is triggering a lot of miscarriages or a lot of hormonal imbalance.
Fibroids, PCOS, ovarian cysts, all of these things, even in the toilet paper. Like every time I use a toilet paper, I'm just like, oh my gosh, I know this has, ingredients in it that's not good for my hormones. And I have a lot of uterine fibroids. And I'm thinking, even when it comes to sanitary napkins, I make sure I spend the extra money and buy the cotton ones because I'm realizing I have to find some ways to be able to help myself.
Yes. And I totally agree. Like it's all over. Even in our homes, there are products that I had to remove some things from my habits and really shift my habits to consider that. Like you said, like I wouldn't use bleach to wash my private parts. So
Okay.
why is there bleach in the products
Yes,
meant
yes, yes.
to
Or the
clean your
sanitary
private
napkins.
parts? Why is bleach or the feminine care products? Why also there's another side to it where there are like, generational, like generations have used other
Yeah.
practices that were more natural. However, now it's almost like individuals are being discouraged
Yes.
from that natural practice where it's becoming taboo for one made up excuse or another. And then these products are
Hmm.
being pushed to the forefront for the girls that are just, stepping into womanhood or having that experience for the first time. And this is all they know because in the schools they're teaching them this. In the stores, they're all over the shelves. This is what the TV ads are. The girls playing the tennis, and I want to play tennis too. However, it's not because of this bleach product that we're using or this man-made chemical that some corporate guy says is the best based on advertising or any kind of institutionalized indoctrination that's happening. So having to have that mental break from habits and practices that were very harmful without without me knowing, and the information that freed me from some of these products to have a better outcome is a big part of like empowering people for their health care.
I'm laughing when you mention about the girls playing tennis and doing all that. And I'm thinking so many of us were having such excessive bleeding and having to be doubled over in pain, and these ingredients didn't help matters for us young women when we were young.
And if anything, these ingredients were pushed for us to buy more or heavy
Oh my
flow
God.
versions of
Yeah.
these products because you started on a regular or a light and now you need overnights
All day long.
long.
Exactly.
These are the things that I had to really stop and do a lot of self-reflection. And I even came down to things like my microwave. Like, can I warm up this item on the stove or in another way? Because these are the little things that we don't realize the larger impact from.
And when it comes to, because we have each race is impacted differently medically. So what one thing would affect another, it would cause more harm another person. For example, I'm just going to use uterine fibroids because that is such a huge problem in the Black and brown community. And the growth of these fibroids, why some races have more growth than others, the foods that we eat, the chemicals that are in our environment. And some of us, it may grow faster because of that. It's not going to work for everyone. It's not a one size fits all. And that is a huge problem. Going back to the chronic pain, we have a lot to cover, but I just wanted to cover this. Going back to the chronic pain and trying to conceive. I remember when I went through my pregnancy, I already had an OB from before who was managing my fibroids. And so he said, okay, I'm not going to manage your pregnancy care until you get past a certain trimester because I was having so much issues, having so much bleeding. He was like, I don't know if you're going to be able to carry this baby. And, unfortunately, it ended in a miscarriage in the second trimester. But one of the things he kept saying, I said, I want to have a midwife because I knew this. I grew up in the culture, being Caribbean, understanding the benefits of the midwifery, of having a midwife, the treatments, and also because of how much complex medical conditions I have, I realized I wanted to avoid being a C-section because I knew the recovery was going to be even worse with the nerve pain and the muscle pain. What's happening with my pelvis that I already had the issues with walking. I was trying to see how much I could have a natural birth, but his take was, and I'm realizing not all doctors are like this, but he was like, nope, you can only have me as a doctor. I am not working with a midwife. And with your circumstances, it's not even an option. And I've spoken to women, all races who have chronic complex medical conditions and disabilities. That's what they're told right off the bat. And we know that having a midwife, a doula as well, will help us to have the necessary care and the recovery as well. So I want to hear how you went with your process, having this disability, having chronic pain, trying to conceive, getting pregnant, and especially as a Black woman, knowing that what we face in the medical experience, and also there's so much of a high, what's called birth mortality rate in Black women. And that's a fear that we have to bring up. You had so much complex medical conditions with your pregnancy. You were mentioning with your blood pressure. So please go ahead, tell me.
Yes, and preeclampsia
Mhm.
does affect women of color a lot more and does have we have dire consequences from it because it can happen very fast and it's deadly, and seeking care, the time it takes to communicate and go back again and have it documented and seek the care and seek the proper care. In that time, we've lost a lot of sisters, and so I have had the experience of even being in the room for another birth, multiple actually, but more recently, like being there for a birth that, again, sorry, I'm getting a
It's
little
okay.
emotional. I
It's
just need a
okay.
moment. But yeah, this is why I emphasize the care team, because it needs to be a team that's effective and
Yes.
collaborative. So for me, like I've gone to multiple doctors to choose. I'm willing to change my doctor. And that's something that individuals aren't even aware of because, maybe I know it is hard to find a good doctor, but we have to be able to talk to one another and share the information because there are gems,
Mm-hmm.
here and there. It's just tapping into it. And I'm so blessed to have a female doctor and a female care team. And it was important for me after going through what I went through after my third miscarriage to have a female care team, because there's an extra layer or an extra dimension when a woman who is a mom is your doctor. And there are little things that are priceless. No amount of money can compare to like a doctor that's willing to give you not just a female OB, but an OB of African descent is like a lifesaver, truly like a lifesaver, because that complaint of a headache can easily be brushed off with a Tylenol 3. And I've had that where I've gone to multiple hospitals in the same day because when I went to one ER, I was literally given Tylenol 3 and had to go back to another one to say, I went to this other hospital and I'm still suffering with the same challenge. And this is part of the advocacy, that you need a care team that's going to also review some of your records from time to time. Because like you said, they might forget one piece of the puzzle that's hiding in the corner, and that might be the piece that's critical.
It's okay. It's okay. Take your time.
I'm
Take your
just,
time. Breathe through it, hon.
we have lost too many sisters to this. Oh, I'm sorry.
That's
I need
okay.
a minute.
Take your time.
But yes, to get to the point, along with preeclampsia, there are a lot of challenges in care, from how the even when you do reach delivery, in the delivery room is a whole new world of trauma that I'm still processing from my birth, but also other births that I've experienced. I have experienced the home birth as well. So having these different experiences really gives me a wealth of knowledge that I'm grateful for. However, I still have to wonder, like, how can we avoid the unnecessary loss of life that many in our community are facing? And why should women be dying early or dying because of somebody not listening to them when they complain? Like, if somebody is seeking care in a healthcare facility, why would more barriers be brought to that individual? Right? Like, to me, it's just contradictory, because it's a care facility. It's literally what they're supposed to do. But it's not the same experience for everybody. And that is the reality. And it's a life and death situation most times. Because another issue in my community is that a lot of sisters don't speak up.
They're afraid to.
The suffering silently is not okay. And I lost
Oh
my
my
mom.
God.
So
Yeah.
all of this may make me more emotional, but it also makes me more invested in women being advocates for themselves in their health care, because it affects generations. And all the girls that don't have their moms, or children that don't have their moms, all the husbands that don't have their wives because of going to deliver, it's too many. And I have a lot of family across the border in the States, and it's much worse
It
there.
is.
It is an unspeakable. It's just.
Okay.
I'm sorry, I don't want to
It's
be
okay.
too
No, no,
negative,
no.
but we should move on.
It sitting in silence with pain, and I don't know if it's just indoctrinated in us, but it's like, no, you're having pain, sit and bear it, push past it. Or if you've gone to a couple doctors and you're like, okay, well, maybe there's nothing wrong, so I just have to just deal with it. And then you deal with it until it gets to the point where people are dying. I've lost 2 people in the past year to ovarian cancer. Black women are very high rates of it. Indian women, very high rates of it. In this case, it was one of my best friends, Black woman, and another Caucasian woman. And things like ovarian cancer, there's so many things that people are complaining about. Digestive pain, some people just say, oh, it's just celiac or it's just IBS. So, you're just having digestive issues, but people are having severe pain and going to the hospital. And they're not getting diagnosed with ovarian cancer until it's completely stage 4. And there's nothing more they can do. And it's devastating. And we look and say, well, why didn't you see this from before? They're not taking the time to be able to do the in-depth research when it comes to this, when it comes to women's health. We struggle with menstrual pain, Oh, you have abdominal pain, even when you've finished having your cycles, you can still have abdominal and that. But this can be overlooked like ovarian cancer and misdiagnosed. It's just passed off. And too many women are dying, as you said. Way too many. So going back to what you said about having a doctor of the African diaspora to take care of your care, you notice a huge difference. I guess tests were done differently where she's assessing based on who you are being of the African diaspora. She took the time to do those additional tests. Is that correct?
Not just that, she listened, like she heard me. And if I made a complaint, she considered multiple options. It was never, it must be this. It was always a conversation of what it may be and what steps I could take for us to get the results we needed. So if I had to do extra blood work, there are optional tests that can be run. And having the conversation with an individual so you can say yes or no to these tests or these treatments based on the information that comes from the tests is really empowering. And also having an OB that was so calm helped me with my anxiety, because that was another challenge. And she was willing to acknowledge my anxiety with the pregnancy based on my history, which not many doctors will. A lot of times in healthcare, especially for women of color, it's about getting over it and not inconveniencing others, though it's their job to care for you. It's literally what they're being paid for. But I was blessed to have the experience that I had the 4th time around. And I thank God each day for that.
How did she help manage your chronic pain with your pregnancy?
Well, all the specialists that I had through my pregnancy were referrals from both doctors, but my OB really took over my care. And it was a conversation that she was willing to have with me on the phone with my doctor to say, based on what I'm seeing, I will be referring them to care in the hospital. And that's really big because there's a lot of diagnostic centers and, other healthcare practitioners that are sprinkled around the city. But when you go to the hospital, you'll find everyone kind of centralized in one building, and also a lot more, advanced machinery, a lot more specialists by going there. And so she took the step to say, this is a shift we're going to make based on some of my complaints. And even when it came to something like you said, an abdominal pain or heartburn, these things can be one little complaint that leads to a greater solution that you wouldn't have had if you were quiet. And so having a doctor who is calm and attentive and takes the time to listen to you is very rare. And I was so grateful for my doctor for being willing to step back, especially towards the end of my pregnancy.
Your doctor meaning your original doctor?
Like my family doctor. And let my OB do a lot of prescribing as well as referrals, which were a lot faster because my OB is based in, though she has private practice, she does also work in the hospital. So she was able to refer me to somebody she knew who knew somebody, and so these networks are not for just one time. This is for life. And she was willing to consider my car accident and all the things that happened with my medical history and take a step to give me a woman of color who was a heart specialist and a woman of color who was a prenatal heart specialist, So these little things, I think, made a huge difference this time.
Her having those privileges at the hospital. When you have a doctor that has the privileges at the hospital, it's like you are now heard because someone else is speaking up on your behalf. Oh, this is a professional who has credentials, and has the privileges at the specific hospitals. Oh, yes, we will support you. But us with our little voices, it's hard if we don't have someone to be able to support us on that. That's amazing. So you had a hospital birth. Was it a traditional hospital birth, or did you have like a private room, kind of like a midwifery type, like a combination of midwife and traditional birth at the same time? I know that's another option as well.
Yes, I didn't really have many options on that day just because we were not planning
she
for
came
that
early.
time. It was a bit earlier than we had expected. So I barely had my hospital bag. Like I had most things. I had my birth plan, which the OB helped me put together in advance. And these are the little things that really make or break your experience, because having certain items you might need that the hospital can't provide, or having a birth plan to say, I know you guys may do this swipe or this vaccine at birth, but I want to know why or what it's for. Being able to say if you want an epidural or not. These are all these things that can sometimes, make a huge difference in the delivery and the postpartum care that you receive. And having an advocate like I did, or having a team of advocates, because I was candid with my pain and I was candid with my struggles and even mental health. I was willing to do counseling with other moms because I was also going through grief counseling during my pregnancy.
I remember you lost your mom at that time, which was very difficult.
Exactly. So all these things considered, it's nice to have somebody who can also say, well, you're also going through a lot in life, and maybe you don't need an extra medication. Maybe you need someone to talk to.
So she prescribed a specific group counseling or as individual counseling for you to give you that support.
What she did was give me the options and allow me to reach out to who she recommended based on what I chose. So it was always up to me. And that was a very new experience for me, because to be given the choice of, this is the way it's been done in the past. However, these are some new innovations we can try if you're willing. That's a very different conversation that not many people get to have in their lifetime.
And did you have a doula as well, or did you just have your OB?
Due to the high risk, I just had my OB, and I was supposed to have her for my delivery. However, things did not go as planned. And we just are grateful for the outcome, but it was a natural birth.
Wow.
And it was 18 hours of labor.
She came early and gave you 18 hours. Oh my goodness.
She came early. She started early, but eventually. Yeah. So all these things make a huge difference in the outcome that I received this time around, for sure.
And with your partner going through this process with you, through the 3 miscarriages beforehand, and now seeing you go through this full-term delivery with your baby, and him seeing the process and the care, what was his take on all of this? And how did he manage this mentally as well with everything that was going on with you?
I must say the first 2 were with a different partner. And so I did have huge changes after that second experience, lifestyle changes, including who I was around. And I think a lot of times individuals don't address the fact that a lot when it comes to conceiving and carrying a baby to full term depends on the genetics of the man. And his genes are dominant in, things like you experiencing preeclampsia, you experiencing morning sickness, you experiencing certain cravings and food aversions, and even allergies that you didn't have before.
Mm-hmm.
And so people don't talk about this part where your body is
Yes.
hijacked by the genes of another
Exactly.
person, by the placenta, and you are pretty much at the mercy of that placenta
Yeah.
until that baby is here. And so until that baby's out of you. And so even in delivery, there are challenges that can come from that. But I was grateful for the partner that I have now because though they were also in a new environment, they held my hand through it. And communication is so important during this time. It always is, but in that room, in that moment, and in labor, it's good to also have the birth plan written and printed with you because you can forget things when you're in it's one thing to be in chronic pain, but to be in chronic pain and then be in labor and then to deliver naturally and the postpartum
Yes.
pains of, yes, everything that follows after you've grown that human and then that human is taken out of your body. Taken out of your body, then there's a lot of changes that follow. So there's a lot of like quiet, taboo around motherhood and this process. And I think if people knew more, they'd be better prepared. And that's essentially what happened the fourth time around.
Okay. I find it's funny that you said this. I was just having a conversation with a girlfriend of mine just the other day that the energy of a partner can make such an impact on the woman conceiving, maintaining a pregnancy, going through delivery, and postpartum. And one thing you've always said is that he's very calm, and that contributes to having a better delivery, having better pregnancy. So tell me about how it was now with your postpartum. Now that you've delivered, how did you manage both with your disability, with your complex medical conditions, and having a newborn baby, and the support also that you had from your care team?
I struggled postpartum for like the first 7 months. I think I was just watching things happen or like just at the mercy of um, my
Mm-hmm.
body. It was really great to have like other forms of communicating with your doctor, like telehealth, because my mobility, I thought I had mobility issues before, but the last trimester, there were times I
Yeah.
couldn't walk or I couldn't, like my hips would dislocate from just trying to get out of the bed, or I couldn't, like my balance would be
Yeah.
off from the headaches and the migraines and lack of oxygen because your organs are squished against themselves. So there's so much that, each journey is different. I had a friend who was taking jogs until like her second trimester, and nobody knew like that she was pregnant because there wasn't any loss of energy or any challenges. But for me, definitely like the initial issues were 150% worse,
Mm-hmm.
like 150 times worse. And I definitely had to lean on like telehealth and having things delivered. And I had to also shift my medications
Mm-hmm.
again based on the hormonal shift that happens postpartum. And then also having to take care of a tiny human and keep them alive.
Did you find with your postpartum that your pain increased afterwards? Your chronic pain increased afterwards?
Oh,
Mhm.
definitely. I'll start with the fact that through the pregnancy, your body is losing a lot of muscle mass and other things, like your cells are splitting, you're losing nutrients, your bone density
Mhm.
goes down, and your cartilage, like because of the pressure of the weight you're carrying, it can affect your
Mhm.
joints. And so after creating a human and delivering that human. The pain was definitely much worse, and I did have to try even some new medications. There was a time I had like 5 prescriptions for like my daily intake, and then I still had like in case of a really bad day because I gave birth in the winter, like a week before Christmas. So there was a lot of like weather and like pressure related pain that on top of having the baby out of your body and your body adjusting to that experience and then trying to walk and do whatever, like climb stairs. That was not an option for me for a while. And nobody could understand why. And then I felt like Rocky Balboa, like on the stairs trying to be like, okay, today I'm going to do 5, and tomorrow I'll do more. But yeah, like it was just being respectful of the pace that I had to take because I went from, I overcame the car accident. I can do anything.
You did have that attitude.
And I'm gonna, remember I was like, Chipper, I can do anything and you can too. But my postpartum definitely humbled me, but it also made me lean on my care team and also my friends and family to be like, I can't do everything and I can't remember things. I know I had a great memory before, but I'm not that person anymore because since I gave birth to a human, I also gave birth to a new version of me. And I don't have as much strength as I did before. Some ladies may have a very powerful, liberating experience from birth, and that's great. But my reality was different. And I had to be real with everybody, even the doctors, to say, yes, like, I'm still bleeding. Like, is this normal? Because a lot of times, because so many things are happening at once, you don't know what's normal or not. And during those first weeks postpartum, you're also like mentally dealing with the experience you may have had. And I didn't have my doctor. And the doctor I did have was what I was trying to avoid.
So that can bring on anxiety.
Not just anxiety, the experience, like even like the forceful breaking of the water, which is a whole new trauma that I wasn't prepared for because my doctor had acknowledged like a placental placement and things like that. But not having my doctor to deliver meant I had somebody that wanted the room emptied for the next
so they
one.
rushed it.
And that's the reality, right? And so if you have a care team, not just in a partner to support, but maybe even another person to say, just give her a break or let her rest. She's taking a nap, because that's something during pregnancy that isn't always encouraged.
Did you say not to take a nap during pregnancy?
Yeah, you can't nap, you can't eat.
I mean, during delivery?
You can barely. No, like, sorry, during delivery, not during pregnancy. Yeah, during delivery. So, and based on like, especially with the blood pressure thing, there are a lot of monitors on you that, so some people may even just have trouble getting the monitors in place. And I've even experienced where people couldn't get the IV in somebody's arm from like 5 tries, which all that is like, it's all traumatizing, really.
It is traumatizing. Sorry, I've experienced that. So it is traumatizing. Because I've heard of women, and we have, I have an episode on traumatic births, but it's something where you're already gone through a lot of trauma prior to. Your body is already a lot of trauma because of the complex conditions that you've had from the car accident, everything, etc. And now you have this person whom you're not comfortable with. You don't know this person. So that's bringing on the anxiety. And then there are all these other things that are happening. So you have your birth plan. Thank God, for the most part, it's going according to plan. But the other things happening are still very invasive, still very aggressive. And you're left with the unknown of how this is going to work out. And that's not easy. That's not easy in regards to mentally or emotionally. Quick question. Did you notice when you were pregnant, with the pregnancy hormones, that even though you were still in a lot of pain, but you were able to, I don't know how to explain, manage the pain a bit better?
No, my experience was the
Yeah,
opposite.
I'm saying it and I had to question myself 'cause I'm just thinking of my experience. Because some women say that when they are pregnant, the pain improves a bit, and then automatically when, like, after delivery, then the pain gets heightened within the first week, because you're not taking your traditional medications as well. So there, even though it's an extreme pain, like you were going through hell with what you're going through, but then now when the hormones have dropped, everything just gets more amplified. And that's what a lot of women I've heard say that with chronic pain.
Yeah, the hormonal shift can maybe it's a different type of pain that I was dealing with because I went from the nerve
Mhm.
pain to the constant sciatica related to the nerve, but then
Pregnancy.
that caused me to rely more on my other side, and then you're leaning, which gives you a different type of a
Mhm.
muscular pain, and then also each move you make when you're pregnant, because your body, especially closer towards the end of term, your body's getting ready to give birth, and your body's
Yes.
looser, your joints are
Yes.
looser, and so that is a different type of
Mhm.
pain, or there's a risk to a different type of injury from that. And if you have a previous injury, especially if it's your joints or your
Mhm.
back, which is
Mhm.
another thing, um, it can be worse with the extra weight of the baby. So I don't know if maybe the hormones, maybe too many changes were happening for me, but towards the end, it was just a lot of pain, just to
Yes.
walk to I had to be closer to the washroom, kind of I had to rearrange my living space just to walk to do basic
Before I
things.
forget, so finish what you're saying, I'll ask the next question.
Oh yeah, and all that is even after giving birth. It takes a while for the hormone change. So maybe I was just dealing with
Yeah.
multiple things. And so it was when you get a break from one thing, it's a different type of pain you're dealing with. Or when you try to, I don't know, reach up a shelf
Yeah.
that day, you're now dealing with another pain.
Just to clarify, I was asking Efia in regards to her original chronic pain, if that had diminished. But yes, all the things that she's speaking about pertaining to her pain is very common with pregnancies. They're creating more physical pain on the body. With you going through the pain and it affecting your mobility during your pregnancy and postpartum, did you speak to your specialist, your OB, about receiving at-home devices to be able to help assist you? Because I remember when I was pregnant, um, first trimester going to my second trimester, I couldn't even turn around because of what's going on with my pelvis in the back. And I had to get one of those rails just to be able to manage. And I use a walker. So it was very, very difficult. And I'm just thinking, I know what you're going through. I'm hoping that they provided those services for you, even a rail for when you're in the shower, accessible devices to be able to help you to manage more effectively in your home.
Yes, I wasn't able to get any permanent devices installed like that, but I was referred by my OB to maybe looking at a different seat
Hmm.
cushion, a different cushion for
Hmm.
sleeping, not just the usual pregnancy pillow, but being mindful of elevations and blood flow and all that because of my previous
Hmm.
injuries, right? And that made a huge difference for me. I did also have a walking I had a
Hmm.
walking stick or
Hmm.
a cane to help me out because it was really funny for me because in the day, certain times of day, I was
Hmm.
okay, but night times, I don't know if it's the pressure drop
Yes.
or the cold in
Barometer
the middle
drop.
of the
Hmm.
winter, but
Yeah.
the night times made it a lot harder to move or more
Yeah.
painful to move and to walk, and so having something bedside made a huge difference. Even to get out of the bed,
Yes.
having a
Yeah.
little rail
Hmm.
tucked under made a
Yeah.
huge difference if you don't have somebody always there to help you
Yes.
get up when you're pregnant. It's really good to have things like that, and even little things that my OB recommended, like a long extended shoehorn.
Yeah.
or shoes without
Yes.
laces. All these things made a huge difference in the experience
Good.
for me.
Good. I'm glad you had that support. And then now postpartum, you're still having issues with walking, so you have those devices temporarily there. Were you advised to have a PSW to assist you, or were you able to manage enough with that? Or family probably was your PSW anyway. How did it work for you?
Yes, I had to lean on family, but I also really had to, again, change the way I did
Mhm.
things and change my mindset of, I think sometimes we think we know things, or something has been working for so long, we don't want to let
Mhm.
go. We're holding on so tightly to things. But I had to shift, like the way I was doing things, um, or ask for help, ask somebody else to do a
Mhm.
lot for me. But personal care, I was able to get by on my
Okay.
own, and with the assistive devices and certain routines, like you don't think things like a bidet might
Mhm.
make a
Mhm.
difference, but yeah, it might for somebody. So these little things are important.
Okay. And the name of your OB, if you don't mind sharing.
Yes, I am so grateful to Dr. Lamide Oyewumi. My experience carrying the baby full term, and even after delivery, my OB came to the hospital to visit me and acknowledged the fact that it didn't go as we
Mhm.
planned, but the baby is here. And seeing her face after giving birth helped me really process and, be even excited for what I had accomplished, because sometimes you forget how much you have done and how much energy that took,
Mhm.
right? Like sometimes we're focused on one side, and you need somebody to be like, "Oh, but look at this side, the silver
Mhm.
lining."
Mhm.
Right? So Dr. Oyewumi was the best OB that I've ever
Mhm.
met. And I'm not the only one. Like, you can Google Dr. Lami Oyewumi, and you will see the testimonies of individuals, second pregnancies, third pregnancies with her, and you'll
How do you
understand.
spell her last name?
So the last name is Oyewumi, which is Oyewumi.
Okay.
Dr. Lami, which is Lami,
Okay. And
Oyewumi.
where does she practice out of?
She's based in Scarborough by Markham and Shepherd, but the hospital that you can connect with her at is the Scarborough network of
She's part of
hospitals.
Scarborough Network. Wow.
Yes, she's a gem. She's a gem. She's a gem in the SCH community.
Okay.
Yeah.
Okay. I'm Markham and Shepherd. I think I know it's that kind of white and blue building on the north west side. Is it there?
Correct. It's Northwest, and that plaza has another gem, which is it has a women's center. So it's not just Dr. O. There are a few doctors, but Dr. O is a doctor, like a
Mhm.
PhD. And so she gives you all the information, and she has all the experience of, her own life experience, but just being in practice for many
I
years.
must have missed her
And
when I used to go to the clinic. There was a practitioner that was there that was my chronic pain specialist at one point. I wish I had known about her then. Wow. Wow, that's just so exciting to hear. And so you mentioned that you have support groups. Do you mind recommending some of these support groups to our listeners?
yes, I highly recommend, if you're on social media, things are very accessible. I mean, obviously, freedom to know wellness, because this is an asset, but I recommend The Honored Womb. It's a colored woman who speaks of not just the birth journey, but they focus on the postpartum journey and the birthing experience itself, addressing things that are in the practice of, birthing in hospitals that are actually harmful, and addressing and bringing the statistics and the data up front and sharing that. So the Honored Womb on Instagram, they have a lot of gems that they post. And there's also an app that I used pretty accessible, one of those freemium apps called Parent Love. And I used that before delivery to learn what I would need to do to care for my baby, because it has a parents forum. It has also like trackers built in, and that helped me with not just what I knew to do and monitoring that, but also things I wasn't aware I was supposed to be doing, because it's all built in.
Good to know. Good to know. Well, Efia, thank you so much for taking the time in your evening from your little two young ones and your spouse to be able to talk with me here on Freedom to Know Wellness. It's been a joy and an honor. And I know this is an ongoing conversation, and I'm excited to hear about all the things that you're doing as well. And this advocacy work that you're actually just sharing with me and helping us to know what women, Black women, women of color, women in general are going through when it comes to chronic pain and miscarriages and trying to conceive and giving birth. It's such, I think we take for granted that women give birth and we're like, okay, it's no big deal. It's a traumatic thing that happens to the woman's body. It's a complete shift physically, emotionally, mentally, spiritually. And we take that for granted. And also what we experience here in the medical system is not easy, and there needs to be changes. And your voice being heard here, my goal is for it to be able to make change in the Canadian society. And thank you so much for taking the time. So to my listeners, as I always like to close, reading information is one thing, but listening to a lived experience is paramount. And that's what we do here at Freedom to Know Wellness. Thank you again, and be blessed. Thank you for listening to this episode. To have your voice heard on Freedom to Know Wellness, email us at info@freedomtoknowwellness.ca. For content like this and more, subscribe to the Freedom to Know Wellness blog at freedomtoknowwellness@substack.com. And for more podcasts, follow our FTK Wellness YouTube channel and find Freedom to Know Wellness on all major podcast platforms. And don't forget us on social media at FTK Wellness.